Welcome back to OpenLine tonight. I have Mary and Sharon here with me from Get Covered, Tennessee. We are answering lots of questions tonight and having some good success if these people will follow up with the navigator. It sounds like you're doing things, they have some positive outcomes headed their way, which is great. So if you have a question about the Affordable Care Act, now is the time to call, because time is running short to get signed up or maybe even change your plan because you're saying, this is not realistic for me and for my pocketbook. What can I do? Let's do this. Get it, call now or call the navigators and they'll walk you through it. So anywho, let's talk about these savings under the Affordable Care Act, because it kind of all gets confusing when you start throwing all these terms out. People are like, what? Do I qualify? What is that?
Yeah, it does get a little hairy. So we try to keep it simple, but it's a little hard. Basically, the general term that we use is financial assistance, but there's really two main ways that you can save money by signing up through healthcare.gov. The first one, and probably the largest one that most people qualify for, is assistance that helps lower their monthly bill, so their premium, their monthly payment, and that's called the the premium tax credit. So to qualify for that, your income has to be somewhere between the poverty line for your household and 4 times that.
Okay.
So just to give an idea, for a single person, that's about $1,000 a month or $12,000 a year. That's the lower limit, all the way up to about $45,000 a year.
And are we talking about take-home money, or are we talking about gross?
We're talking about gross.
Okay.
In most cases, it's your adjusted gross income that would be on your tax return. There's a couple things that change that we look at, because for the Affordable Care Act we use the modified adjusted gross income, but for most people it's exactly the same as what their adjusted gross income is on their taxes. So that's the premium tax credits. That's what most people qualify for to lower their monthly payment. But there's another part to insurance, and that's when you go to the doctor. When if you go to the emergency room, if you have to have a surgery, what do you actually pay? Those are your out-of-pocket costs, and those can be really high. So in order to help a certain section, it's a little bit smaller. Instead of being 100% to 400% of the poverty line, it's 100% to 250%. So it's a little bit smaller segment, but it's still quite a bit of folks. And they qualify for something called cost sharing reduction, which is a really long term for basically your deductible is lowered, your out-of-pocket maximum is lowered. For a lot of folks, they end up having no deductible, which is amazing. Great. It's like their insurance kicks in from day one. Or they might have a deductible of a couple $100s. They might have lower co-pays. And
can you qualify for both?
Yes. Yes. So if you're in that lower category where you're between 100 and 250% of the federal poverty level, you qualify for both. So you're getting a lower premium and you're getting the cost sharing reductions, as long as you choose a silver plan. And we had a caller earlier who had some questions about her income and a really high deductible, and that's why we urge, if you are in that category, you really want to look at the silver plan.
And there are silver and bronze plans.
There's bronze, silver, and gold. Some areas have platinum as well, but here in our area, it just goes up to gold.
What differentiates between having a silver plan and having the gold plan, or whatever?
If you're getting cost sharing reductions, the silver plan is even better than the gold plan. But the idea in general is that with the bronze plans, you have lower monthly cost, but you're going to pay more when you go to the doctor. You're going to have a much higher deductible. Whereas with silver plans, you pay a little more per month, and when you go to the doctor, you pay a little bit less. Silver is kind of what we call the benchmark plan. It's what most people might be used to if they've had employer coverage. It's more like an 80-20 split. And then gold plans are for folks who maybe have really high medical needs, or they know they're going to be going to the doctor a whole lot and they want those low costs every time they go. And they're willing to pay more per month to know that when they go see their specialist, they just have a copay. So those plans are the most expensive monthly. Now
if your brain is doing circles and thinking, what the heck are they talking about? This is why you call the navigator. We've been putting that number. No, you guys do a great job of explaining it, but you know, anytime you start talking insurance, people's eyes just glaze over. It happens to me, and I'm like, oh, here we go with this conversation again. You know, it's like once a year you want to beat your head against the wall. I don't have to do this. Hey, here's a question for you, and then I know that we have Daniel on the phone. Daniel, we're going to get to you. Hang tight real quick. You know, for a lot of people who are employed and offered health insurance, which is a great benefit that companies offer, they are still running into plans where they say, it's so expensive, or it went up so high. Can you check out what's happening on healthcare.gov? Would you qualify then, or you're out of the mix? Sorry.
Yeah, as long as your employer is offering job-based coverage, then you're not eligible for the advanced premium tax credit.
Okay.
You can't get that financial assistance unless the employer coverage for that one employee, that premium is more than 9.5% of your income. I know, here we go again.
No, but that's good information. It is.
You know, then you may be able to qualify for the financial assistance, but you'll have to get your employer to fill out an employer coverage tool to make certain that it's unaffordable on the job.
And that plan would really have to be expensive.
Yes,
for that to
because
happen.
it's not for the family. So a lot of people think, oh, my family coverage, I got 4 people on it, it's $800 a month.
Right.
They're not going to look at the family coverage. They're looking at the employee only premium. So then that's going to be way lower than the $800 a month.
Yeah.
It might not be make you eligible for the financial assistance on the marketplace if you have job-based coverage.
Okay, good to know. Let's get to Daniel. Oh, Daniel disappeared. Daniel,
I'm sorry, I talked too long.
No. If you, we got all the lines open. So if you have your question, call right back in. We'll get to you. So we've talked about the penalties. We haven't talked about the penalties. And people are just saying, I'm not going to do it. Yeah, I'm not going to do it. What are they facing?
Well,
$695 this year.
yep.
Or
$695.
2.5% of your taxable income, whichever is greater.
Okay. How's the government get that money?
Through your taxes. If you owed a refund, they're going to take it right off that refund, or you can get a tax bill for that.
So they are going to
penalty.
get it.
They're going to get it.
They're
They're going to get it. They're going to get it. They're going to get it.
All right, and that penalty has gone up over the past couple of years, but right now it's going to kind of stay at this point, right? So $695 or 2.5%.
2.5% of your taxable income, whichever is greater.
Okay.
And a lot of times it's that 2.5%. A lot of people get that $695 stuck in their head and think, oh, and then they may get there and it may be $800, and they go, you
What
said $695. They forget that. Or 2.5% of your taxable
I think
income.
it's about, if your income's about $40,000 a year, you're going to be in that,
The
or
2.5.
higher, you're in that 2.5% category, and then it just keeps on going up from there.
So you have to
there's
know
no cap.
January 31st. If you don't get it done by then, you are going to be paying a penalty. Let's talk about dental coverage. We've talked a lot about health care coverage, medical coverage. What about dental coverage?
Dental coverage is not a part of the medical coverage that you get, but you can add it. So once you choose your medical plan on healthcare.gov, then it'll go, okay, do you want to enroll in some dental coverage? And you may say, yes, I do. And they'll show you some separate dental plans that you can add to the medical plan that you just purchased. And usually, they have some from $16 all the way up to $40 a plan. They have lots of carriers on there. I've seen Delta Dental, I've seen Humana, Cigna, Best One Life, DentaQuest. They've got a lot to choose from. What I would say to people when they're picking that dental plan is to just look at all the limits and exclusions and click on them, because some of them may exclude major dental, or they may have a waiting period, 6-month, 12-month waiting period. Or so you really need to click on all of the limits and exclusions to make certain that when you make that choice, you are aware of any waiting periods, or major dental is not covered, or there's a $1,000 cap on this policy. So if you do that, I think you'll find something that you're pleased with.
All right, so just read the fine print
Read the
on those.
fine print on the dental, yeah.
Okay, as always. I'm told that Keith's question was about pre-existing conditions, and that is a great question because that's part of why the Affordable Care Act was created, because so many people could not get coverage because they had ailments, and health insurance companies are saying, no, we don't want to insure you, or we'll insure you for a great amount of money. So what is the deal with the Affordable Care Act?
There's no questions on the marketplace application that ask about any pre-existing conditions. You don't have to put in your weight, your height.
No one asks questions about medical history.
No, nothing. So it's not based on that at all. The only things that determine your premium amount are your geographic area, your age, and whether or not you smoke.
Yes.
Okay.
So those are the only things that affect it.
The cynic in me would say, well, if I had signed up in 2015, then they know what I went to go see the doctor for, and they may know that I had cancer, or they may know that, X, Y, Z. Then my 2016, bill's going to go way up.
Right.
Is that the case?
No.
How do you know that?
No.
I told you, I said the cynic's going to come out.
So.
It's healthcare.gov so the prices are standardized from the insurance company, and they have to share that information with healthcare. healthcare.gov. Any 58-year-old male living in this county, we're going to charge this amount. So when you do your healthcare.gov application and they see you're a 58-year-old male in Davidson County, they're going to give you that premium price for the. So it's kind of like a blind process, I guess I would say, where the insurance company, when you're going back on to reselect that plan, they're not making that price for you. It's just a standardized price for anybody in your
age
group in your
kind
area.
of like, the actuarial stuff they do at the insurance company.
So don't think that because you have a condition you can't get coverage.
Yeah.
Okay.
Exactly.
Okay. I'm told, let's see, we have Brian on the line. Brian, thank you for being with us. What's your question?
Yeah, I'm wondering, these ladies, are they government employees? And I was also wondering, what about, they're going to be, the Trump administration claims they're going to be rolling this back. How is this going to affect this? I'm just curious about that.
That's a great question. We kind of talked about that being this show because, it probably is on a lot of people's minds as they say, should I sign up? Should I not even bother with it? What if my coverage goes away in mid-year? What do I do? So first of all, you're with Get Covered Tennessee. Who's paying your bill? Is it a government organization?
Go ahead.
We work for a nonprofit agency here in Nashville, a local agency called Family and Children's Service. So they're our employer, and like I said, they're a nonprofit social service agency, and our program is funded through a federal grant from the Department of Health and Human Services. And part of the Affordable Care Act, when it was written, was to include funding for our positions. So it's actually part of the law that they have to provide funding for in-person people to help you,
sign up.
Because we've been talking about how necessary it is in a lot of cases and how helpful it is for people to have somebody to go to, an in-person assister. So.
And Sharon, when you're meeting with people, are they saying, is this going to continue all through 17? What if Donald Trump repeals it? What do we do? What am I going to cover?
I do get those questions, and I just try to assuage their fears and just say, today this is available to you. We believe that if you get signed up, you'll enjoy your policy throughout 2017, and just don't worry. I mean, really, that's where we are.
You have nothing to lose by signing up.
You don't have anything.
So
that's a good point. You don't have anything to lose by not signing up.
Yeah,
that's so true.
It's not like you're going to be penalized for signing up or anything like that. So,
and we all know it doesn't matter which side of the aisle you're on. To get anything passed through Washington, it's
going to take time.
It's not going to happen January 20th, no matter what. Nothing can happen like that. Our government is not set up that way. So just know that going forward. Yes, it may be changing in the future.
But I like what Mary said. You don't have anything to lose by signing up, but you might have a lot to lose by not signing up.
Yeah.
You really may have a lot to lose by not signing up. You will not have coverage. You may get sick. You'll need.
Can't predict medical emergencies.
You can't predict it.
Nope.
And it's very expensive when you don't have insurance.
Yes. Yes. It can be expensive even when you do.
Even when you do.
Imagine if you don't. Yes, it's a nightmare.
It's a peace of mind, though.
Yeah. Okay. Courtney, you told me we could take a break, right? I think so. Okay. We're going to take a quick break. If you have questions, get on the line right now. We have one more long segment to take those questions. So time is running out. Do it now. We'll be right back.